As I was introduced by the chair of this session, my background is cognitive science and psychology. So from the perspective of a psychologist, I think we can say as social animals, we seek a certain level of social stimulation. So our social brain may be hungry for social interactions when we are isolated, just as our body is hungry for food when we starve. So when we do not get a healthy dose of positive social inputs here through a cooperative kind, we and our brains can suffer. But we also know that social interactions can be a source of great stress. Right? So when many people suffer from social relations as much as they suffer from lack of social interactions, such as isolation. And also it takes efforts to learn how to trust or cooperate with and reconcile conflicts with others. So some parts of this social function, as we saw from the presentation by Dr. Tomasello in the morning session, are in place from very early on in our life, but we still need to hone this skill throughout our lifetime. So then one more thing that I want to bring up. So now we are in a situation where we can meet people and make friends online instead of directly interacting with them offline, which is probably very different from what our ancestors have to deal with at their time. So today, indeed, a lot of people are actually participating in this event online. So this online world has a great benefit, certainly has enabled social interactions that were not possible before. But at the same time, it has reduced the opportunity to learn basic social skills that's required for cooperative social interactions, I think. So then our dependence on these online interactions has been increasing since the COVID-19 pandemic and social distancing, the factors already mentioned by Professor An. So given these circumstances, we may need a different kind of strategy to encourage social cooperation in our society. So my question is, I'm wondering about your thoughts on how we can promote healthy cooperative social interactions among us for our mental health while avoiding negative aspects of stressful social life, and especially given that we spend a lot of time in the online world. So, and in particular, how we can make it as a societal effort.
디지털 기기를 또 많이 사용하게 되면서 사실은 사람들이 실제로 사람을 만나지 않고 온라인에서 사람을 만나는 게 정신건강에 좋지 않을 수도 있다라는 그런 걱정들을 많이 하는데요. 반면에 저는 좀 이런 실제로 만나지 않고 디지털 기기나 아니면은 이제 온라인에서 하는 행동 이외에 다른 행동을 하는 것들도 온라인에서 이제 사용할 수 있는 다른 장점들을 사용해서 오히려 좀 소셜 인터랙션을 좀 높일 수 있다고 생각을 합니다. 왜냐하면 고립된 사람들 그리고 이제 어떻게 보면은 물리적으로 우리가 연결되지 못하는 사람들도 있을 수 있고 우리는 디지털이나 여러 가지의 온라인의 발달이 실제로는 지금 살아가고 있는 MZ 세대들이나 신세대들만 사용한다고 사실은 생각을 하지만 실제로는 이제 도서 지역에 있는 사람들이나 실제로 사회랑 조금 많이 떨어져 있는 그런 사람들에게도 도움이 되는 측면들이 분명히 있거든요. 그래서 저는 그런 어떤 온라인상에서의 소통 그리고 디지털의 발달이 이런 인터랙션을 막는 것보다는 조금 더 기술적으로 사람들의 관계를 더 발달시키고 정신건강을 조금 증진시킬 수 있는 쪽으로 갈 수 있다고 생각을 하고요. 또 이제 사실 디지털이나 이제 온라인에서 제가 또 이제 긍정적으로 이제 보는 그런 면 그리고 이제 교수님께서 질문해 주신 어떤 정신건강의 증진에 있어서 이런 것들이 이제 우리가 사회에서 어떻게 좀 협력을 할 수 있냐 그런 부분에 있어서는 예전과 다르게 이제 정신건강에 대해서 우리가 오픈하는 부분들이 많아지고 미디어에서도 이제 우리가 셀레브리티들도 우울증이라든지 자기가 공황장애를 앓고 있다 이런 부분들도 많이 좀 오픈을 하고 그런 게 이제 SNS나 또 디지털 문화를 통해서 많이 좀 쉐어가 되고 내가 이제 정신과 다녀오고 심리 상담도 받고 이런 게 좀 되게 쿨한 문화로 굉장히 좀 치부가 되면서 굉장히 요새는 자기가 문제가 있지 않더라도 먼저 이제 병원에 와서 좀 진단도 받고 평가도 받고 그런 부분들이 있거든요. 그런데 이제 저희는 그런 얼리 디텍션이 사실은 이 질병의 예방이라든지 좀 더 이제 안 좋게 진행하는 거에 대해서 더 굉장히 중요한 부분이라고 생각을 하는데 이제 예전에는 그 어떤 뭐 정신 건강의 문제가 질병으로 생각하고 고쳐야 될 거라고 생각을 했다면 지금은 그런 문제들이 미리미리 좀 예방을 하고 조기에 이제 잡아내고 이런 부분들이 조금 더 이제 중요하다고 생각을 해서 그 이제 급변하는 여러 가지 좀 뭐 디지털 시대 기술의 이제 발달들이 그러한 변화들을 조금 더 빨리 좀 감지를 하고 그런 게 지금 사회에서 조금 더 도움이 되고 그리고 이제 그 일반적인 뭐 국민들한테도 이런 정신건강 문제들이 조금 더 이제 알려지는 계기가 될 수 있지 않을까라고 생각합니다.
Thank you. I think, Professor Gu, you might have any comments from sociology perspective on this issue?
Well, I thought probably, I mean, thinking about what Michael Tomasello talked about in the morning, what determines the quality of the social relationship depends a lot on things like shared attention and shared intentionality and to what extent participants are committed, whether they're willing to be properly assigned to their roles, things like that. So all those elements work in a proper way. Cooperation itself might be beneficial for all the participants. Okay? But in other contexts, I think it doesn't really matter whether we talk about online community or offline community. The face-to-face interaction might be, in general, might be influential and beneficial for people who interact with each other. But even though we talk about online community, if we can make sure that participants can have better communication, be committed to some shared goals, and sharing some shared intentionality, things like that, it could be also beneficial to people who join the forum. So if you think about, for example, like internet online communities, there are a lot of online communities where young people get together and get their views shared, political and social economic matters. And if they are committed and they get to know about who they are and they agree upon some codes, share ethics, respect each other, it might be good for social and mental health of people who join those kinds of internet communities. That's my view on the question.
Thank you very much, and sorry for calling your name without notice. Let's turn back to Professor Shim for her comments on Professor Jo's presentation.
Right. Before that, I agree with what Professor Ku said. So the importance of a shared social goal may be a key for this. And for an online interaction, maybe like we need to first establish the healthy social norms. I mean, there could be a new thing to introduce for this kind of new online world, I think. So that maybe help increase the more healthy social interactions and alleviate the negative problem of too much of the social interactions or new kind of social interactions, I think.
I mean, the truth is that we don't know much about what's happening online, whether they create and maintain social norms that might be shared by the participants and who are participating, and then what are the characteristics of the participants. And we tend to have a kind of stigmatization and judgments about who they are. These are the ones that keep producing like negative remarks and derogatory remarks toward others, and that's the place where hatred comes out. That's the perception we have about the people who do not express online, but really sneaking into the online spaces and trying to express their views and opinions. So what is needed, if you think about the future of cooperation, which is really widely happening in online spaces, we need to know more about who they are and what are the preferences for young people who prefer online communication as opposed to offline communication.
Okay, so now this question is for Professor Jo, who nicely introduced borderless collaborations at many levels in clinical research. Open science is a great ideal, But when we implement it, there may be some problems, obstacles, and some unintended side effects. So we know that there are costs for producing the data, and make this open science work, we need institutional support. And also, some people point out open practices may not be so rewarding for early career researchers. But however, I think that when this practice is embedded in education, you mentioned early on, it can be beneficial to the field in the long run. So these conditions may also be shared by clinical research, or their circumstances may be quite different from basic science fields. So what do you think the biggest hurdles for these open science efforts in clinical research? And can you share your thoughts on how we can possibly overcome if there is a difficulty?
So thank you for the question. So it's very similar to what you're experiencing as well. So in clinical research, so let's say maybe 20 years ago when I did my PhD, it was really hard for PhD students to find the data set. So it was one of our mission is make your own data. But nowadays, if you have a good research question, there is many data you can actually get. So maybe UK Biobank, even for a Korean genomic project, or many different data are available. So I would say it's a more open and transparent. But in terms of a clinical research, one of the requirement is transparency and reliability and standardization. Because you really need, we always says it's evidence-based medicine. Then what we are really lacking is, as we provide, is research method. So it's easy to get the data, but people are really afraid of if people use it in a wrong way, you can get the wrong result. So some people are really hesitating to share the resources. But some like a big institution like UK or US NIH or UK NHIS, they really eager to sharing the data and put the platform for the open science, because they believe this will help them to really accelerating the finding. But I think still for like really helping this open science culture and effort, we really need to more expert in clinical research method. That's what really we are heading for. And also at the same time, as I mentioned at the very last of my slide, research methods are changing rapidly. So it gets more complicated and more advanced. But people were still live in, like, I would say 1990s. So even we actually had a meeting with faculty at Johns Hopkins School of Public Health a few weeks ago, and we were discussing about this seriously. Even at Hopkins, we feel like we teach the wrong, like old things, but we really need to find the better, like improving the curriculum and teaching the advanced method. I mean, that's the way we can actually booster this open science effort. So last thing, as you mentioned, the more opportunity for juniors or more opportunity for students, that would be also helpful for booster up this open science. And because they need more support, but as you can imagine, like junior faculty or students, they are the one who read more support, but they are the who got less likely to get the support. So I think that's one of the things we need to not only in Korea but worldwide, we need to put the more effort on it.